Hello, everyone. We have quite a few people here, so I think that we're good to go ahead and get started. Welcome to the webinar series for the Autism Intervention Research Network on Physical Health, the AIRP. My name is Keisha Rosenaw, and I'm a developmental researcher at UCLA and a project scientist on the ARP. I want to thank all of you for joining us today. And before we begin, I'd like to address a few logistical details. I will provide a brief introduction for our speakers and will also reserve time to answer questions at the end of the presentation. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the chat box on your webinar console. The entire webinar is being recorded and will be available on the AARP website, airpnetwork.ucla.edu. There will also be a short evaluation survey at the close of the webinar. We invite you to provide feedback on this webinar and also to provide suggestions for future webinars. In the interest of time, let's get started. We first want to acknowledge the Health Resources and Service Administration as the funding source for the AARP. Now, it is my honor to introduce the AARP Health Systems and Services Node Team, Lindsay Shea, Ann Rue, and Paul Shattuck. Dr. Shea is an assistant professor at Drexel University and the director of the Policy and Analytics Center at the Drexel Autism Institute. Ms. Rue is a research scientist at the Drexel Autism Institute and a co-producer of the National Autism Indicators Report Series. Dr. Shattuck is a senior fellow at Mathematica and the founding leader of the Life Course Outcomes Program, the National Autism Data Center, and the Transition Pathways Community Partnership Initiative. Please join me in welcoming Dr. Shea, Ms. Rue, and Dr. Shattuck.
Thank you for that introduction. It's terrific to be here. Next slide, please. So we're going to be talking today about some of the approaches that we've developed. And I say we, I'm currently at Mathematica Research, which is a policy research firm, but formerly was at Drexel. So I work closely with Lindsay and Ann and have worked with them for years. So we've developed different ways to try to bridge research to policy practice and informing policy. And we want to kind of present a range of ways and tactics that we've used to accomplish that, and hopefully stimulate some discussion at the end of the presentation about ways that we can collectively work together to tighten up the linkage between the research that we do and how it connects to the policymaking process. Because in the transition area, you know, we have roughly 100,000 or so young people on the autism spectrum turning 18 every year. And yet in the research realm, we've noted that many times the interventions and some of the studies are very small scale. And we have kind of policymakers are often asking us questions about how findings translate to the policy arena where things operate at a much larger scale. So we've been grappling with that, and we'll share some ideas today. There's always room for improvement, and we're not at all here to pretend that we have all the answers. But these are some of the tactics that we've tried, and we're eager to share and get feedback and hear what you've been experimenting with. So as you all probably know, this is a friendly audience, and folks know this, but I'll just summarize it. You know, we spend billions a year on educational and community-based services for children, teens, and adults. And we also have spent billions over the past decade and a half on research on autism. And when we started this program, the National Autism Data Center at Drexel, I guess in 2014, that there wasn't a lot of population level data that wasn't well represented in the world of autism research. A lot of autism research focused on neuroscience and genetics and small trials for behavioral research, but there wasn't a lot of research happening in the arena of population-based data. And I remember going to a lot of meetings in the early 2000s, 2010 or so, and there were these kind of emerging threads of conversation about, like, how are we going to help people across the lifespan who are on the spectrum. And people were using this phrase, like, we need to move the needle, right? We need to move the needle on outcomes like employment and community inclusion and so forth. And I'm a pretty literal person, so I was like, well, where are the gauges? Like, let's do that. Let's move the needle. And we realized there just weren't many gauges. So we've been attempting to build some gauges with our national indicators reports and slowly building some infrastructure at a national level to tell the story of the kind of help people need and how life turns out. There's another old saying in quality improvement circles in healthcare administration that every system is perfectly designed to get the results it produces, and that system level problems require system level solutions. So the other way that we think about the contribution of the work that we do is by providing that sort of systems level 100,000-foot view of how our systems of care are performing in hopes of stimulating innovation and improvement across the board. Next slide, please. So the Autism Institute at Drexel University is the first autism research center that was specifically built on a foundation of approaching challenges using a public health framework. So the programs at Drexel all take a public health approach, which kind of pursues this is one way to represent the public health outlook, defining problems, what are the causes of the problems, what's working and for whom, how do these findings relate to improving policies and programs at a population level so that we can actually see measurable improvements in services and outcomes at a population level. Next slide, please. So with this national data center that we have and our national indicators reports and the fact sheets and various products that are available on the Drexel Autism website, we tend to keep our questions pretty simple, because in our experience, policymakers, legislators and staffers and state agency directors, if you start talking about t-tests and regression results and stuff like that, they glaze over and you lose them pretty quickly. So we've learned to keep it simple if we want to really influence and inform the policy process. And we have a very small number of basic questions that probably constitutes 85% or so of the work that we do. What kind of help do people need? What kind of help are people getting? What's the gap? What are the unmet needs in terms of community-based services? And how's life turning out across a range of indicators of health, educational attainment, social role participation, employment, friendship, all that kind of stuff. So these tend to be the kinds of questions that most of our service systems are built on. And answering these questions actually go a long way to helping stay relevant and partnered with policymakers, because most policymakers want to know pretty concrete answers to fairly straightforward questions. And if we get too lost in our academic jargon or complicated analyses and complicated results and too much hedging and qualification, we quickly lose the legislative audience when we're trying to communicate our findings. Next slide, please. What do we need? So we need population level data about unmet needs and outcomes. We need program models for working with individuals. We need capacity building models for community organizations, employers, and systems, and collaborative community-based problem solving for convening and mobilizing resources. So this represents kind of the range, the 4 big buckets of the work of the Life Course Outcomes program at Drexel. And today we're really talking about the leftmost box of population level data. Although I think Lindsay might be touching on some of the capacity building and collaborative community problem solving work. Next slide, please. So as I mentioned, we don't have a lot of gauges, although we've been making good progress, I would say, in the last 6 years or so with the work that we've been doing. A lot of the work that we do documents unmet needs, which is something that we found a lot of service providers, state agency directors, directors of federal agencies, they spend a lot of their time thinking about the unmet needs of vulnerable populations. And to do the work that they do, they need reliable information about the quantity, the scope, the number of people, the high-risk groups. And there's an old saw in policy that a needy population doesn't count until someone counts it. And that's kind of like one of our mottos. And we're in the business of like counting people who need help. And again, we try to keep it simple and try to keep it tightly linked to informing major public programs. So there's a big opportunity here. We've been working in this field, in this garden for quite a while, and we welcome other people to get involved. There's a lot of important work to be done, and lots of opportunities for collaboration and thought leadership. Next slide, please. So we have this, I'm sorry if you can hear, there's a car alarm outside. I'm sorry if that's interfering with the sound here. We have this National Autism Data Center. When I talk about it, you know, people often like imagine something like this, but it doesn't actually look like this. This is the picture of, I think this is the International Space Station Command Center or something like that. The National Autism Data Center is a pretty humble operation. We have a couple of staff who are wizards with secondary data analysis, and we have a secure room that's kind of a glorified coat closet, but it's a lot of the data sets that we use have data security requirements that require us to keep them on computers that are isolated from outside contact and be locked away in a special room. Next slide, please. The framework, kind of the orientation of our National Autism Data Center is captured in this slide. We seek to be the source for useful, trustworthy statistics in the realm of autism. We do this through three major activities: stakeholder engagement. Stakeholders would include policymakers, program directors, community-based service providers, families, autistic individuals, really across the board, wide range of engagement activities. Information products for non-scientists. So we specialize in creating, we certainly do peer-reviewed articles. You know, we have to do that for all of our grants, but we also have a very large machine for developing reports, fact sheets, and other kinds of information products. And then we work this process of dissemination to decision makers, which we'll talk about in a minute. And why do we do all this? We do this so that problems are framed and awareness is raised, ultimately leading to policies and programs that are grounded in good data. And in order to support systems, policy, and program efforts to generate measurable improvements. So that's really why we do what we do. At the end of the day, we're hoping to build the infrastructure and the framework for measuring whether all those billions of dollars are moving the needle on outcomes. Next slide, please. So the work is you know, the devil's in the details. We have, as I said, a very talented staff, and there's a growing collection of data sets that we curate. There's over 30 different national and administrative and survey data sets that we curate, and we organize those data sets in various ways. And one of the ways we do that is just trying to organize which data sets cover which topics. And so this is just a snapshot of one of the tools that we use to visualize, so that when we get a request from a legislator or a federal office or agency, and they say, hey, we're interested in healthcare transition, you know, do you have any data on healthcare transition? We can very quickly zoom in on the collection of data sets that have some variables that address that topic. Next slide, please. So we've had quite a bit of success. The 2015 report, which is really our flagship pioneering report that Ann Rue was the lead author on and really the mastermind behind, became kind of the template for the subsequent indicators reports. It's won awards and it's been cited a gajillion times. It's really made a much bigger splash than we ever hoped for. It's been tremendously influential on the field. And we get a lot of contacts, and we've done presentations to the legislative caucus at Congress, and we do a lot of consultation with federal and state agencies. We have these reports on our website. You're welcome to access them there. They get downloaded a lot. We get a lot of email requests for custom data runs to address particular issues that policymakers are trying to address. And we don't imagine that any particular information product or report is going to make a huge difference in and of itself, but by creating a robust stream of products and information reports, we try to like keep these issues on the radar screen and keep a steady stream of outputs going into the policy arena so that policymakers, journalists, state agency directors they kind of know where to turn basically. And we try to kind of become that go-to place for those types of statistics. Next slide, please. So how do we achieve impact with the data? So we have a variety of approaches. A lot of this, if people want to get geeky at the end of the presentation, I'm happy to answer questions about the conceptual framework that backstops our sort of theory of change about how we imagine the work that we put out into the world will influence or inform policy. But the nuts and bolts, we do a lot through partnership. High leverage nodes refers to advocacy organizations. There's a handful of legislators in Congress who've really identified autism as a priority issue for them. Certain states, legislators, some state agency directors. We have kind of a short list of organizations and people who exert an outsized influence on the world of autism policy. And we've made it our business to partner, to get to know them, and to make sure that we're asking them about their information needs on a regular basis, so that we can have an outsized impact and influence on them as they're struggling to respond to challenges in the autism arena policy-wise. We have a very active social media presence, and we also try to partner with other organizations that have a big social media presence. So when we're disseminating our products, we do a lot of that dissemination through partnerships with other organizations that have a very big social media footprint. We actively court attention from news media. We reach out with press releases from all of our major products when they're released. We do TV and radio interviews. We've been on NPR a bunch of times, national newspapers, a couple of times I've mentioned on TV. And we cultivate media contacts. We have kind of a short list of beat reporters who've taken on autism as their key interest, and we stay in touch with them and try to make sure we reach out to them periodically to learn about their needs as well. We do direct email to educate people about the findings as they emerge. We cultivate and seek out speaking and consulting opportunities so that we're always getting ourselves out in front of audiences, and particularly non-academic audiences. We do a fair amount of speaking at state autism conferences that are pitched more at families, people on the spectrum, service providers, that kind of thing. And we, again, ultimately, we try to cultivate a robust and steady stream of scientific articles and information products to keep these issues on the radar screen. Next slide, please. So some of the outcomes I've mentioned already. We have regular meetings with legislators and agency staff at the federal and state level. We've done consulting with the GAO. Up until last year when COVID hit, we had been doing at least once a year, sometimes twice a year, briefings with the Congressional Autism Caucus. We do a lot of work with various local groups, particularly in Philadelphia. As I said, we court media coverage and promote coverage of autism issues in the news. We have our own social media platform on Facebook that has about 10,000 followers. Some of our reports have been flagged as among the top 20 most influential studies in the field of autism. A bunch of the statistics from our reports have made their way into federal legislation, including the CARES Act. And it ends up being like, quote, good for business for the university. So those of you who are in university settings, you know how important it is to kind of, please the provost and please the president. And it was interesting when we started this work at Drexel, there were some higher ups who were kind of skeptical about the value of investing in this indicators work and secondary data analysis. But the proof is in the pudding, and now they're in our corner now because it's all these outputs and outcomes have generated tremendous good press for the university overall, and have also led to significant philanthropic contributions from major donors to support the work. Next slide, please. And I'm going to turn it over to my colleague, Lindsay.
Thank you, Paul. So in addition to the work at the national level and in generating indicators, there's also been a tremendous amount of energy in Pennsylvania to think about where we have opportunities to inform policy and for policy to be a component of project activities start to finish. And so one example of that is the Pennsylvania Autism Census, which is led by the Autism Services, Education, Resources, and Training Collaborative, Eastern Region. That's funded by the State Bureau of Supports for Autism and Special Populations. And the reason for the Pennsylvania Autism Census was that policymakers were saying, how many people with autism are in Pennsylvania? And that very question drove this initiative to look at administrative data sources across where people are getting care, including healthcare and physical health needs, and many other sources. And by engaging in this project hand in hand with policymakers and being informed by policymaker questions, we were able to generate a product that people can use. And so this site that lets people click on their county and look at information about the number of people on the spectrum who are in their county using these administrative data sources has been accessed to date more than 12,000 times by people in Pennsylvania who hope to learn more and do more with this sort of data. A natural follow-up question after you know how many people are living in the state, which by the way tripled from the first Pennsylvania Autism Census until the second iteration that was conducted a few years later. The next question becomes, and what do these individuals need? What do families need? And so by working again with policymakers within the scope of service delivery opportunities in the state, and to try and understand specifically healthcare needs and physical health needs, the Pennsylvania Autism Needs Assessment surveyed individuals living in Pennsylvania as well as their caregivers, and uses that data to then display across the life course domains where people report that they need things to change. And so by partnering again with policymakers and informing the survey design so that they are policy relevant, data collection opportunities really produces a broad array of opportunities for system change to improve outcomes. And the Pennsylvania Autism Needs Assessment has traveled, so across the US and the US territories. Other folks have used components or the entirety of the needs assessment tool, which allows for new ways for other states to also partner with policymakers and think about how using these sorts of initiatives can drive toward exactly the type of data that Paul described to help us design systems to meet people's needs as robustly as possible. At the international level, the International Society for Autism Research recently implemented policy briefs, which are meant to take an issue that is a top priority to the autism community, and specifically the autism research community, and put it into a policy brief format that individuals from around the world can understand and use. And so we were selected to lead the next INSAR policy brief focused on autism in the criminal justice system. And this also has potential health outcomes, both by way of health as an impact before criminal justice system outcomes as well as after. And we see a tremendous amount of opportunity to use what we've learned from that INSAR process also here in our work on physical health. And I'll turn it over to my colleague, Anne Roon.
Thank you, Lindsay. So as Paul mentioned, I have had the privilege of helping to lead the National Autism Indicators Report. I believe that we've produced 5 so far, and we have several in the pipelines. And I would have to say that it's been one of the more rewarding activities of my career. Not that we went into knowing how to do it at all, but I think that what we were able to learn and the opportunities that we've had to really meaningfully share information with people who need it has just been incredibly fulfilling. So what I want to talk to you about is how we think about identifying policy relevant issues, and then just a couple lessons that we've learned over the course of producing both reports, but also sets of fact sheets and talking points from articles that we produce, how we get information out into the world. So as you can imagine, there are so many research questions that we could answer, and we have many people that come to us and have specific questions that they need answers to, whether that is housing opportunities for people in the community, to what are effective ways to help people become employed. There are just endless amounts of things that we could tackle. But it's really important for us to identify questions and problems that are at a systems level of issues, because that's really where our work, we feel, has the most maximal impact for change. And so some of the questions that we ask when we think about what are the topics that we might address in a national indicators, autism indicators report, for example, are first of all, what is the problem? Not just what is the research question, but what is the societal problem that the information we're producing is addressing? Does it address real world problems that really will improve people's quality of lives if we have answers for those questions? And then what type of problem is it? Is it a policy problem? Is it a practice problem? We try to identify policy issues, and we think about the answers that we produce. Where would the intervention focus? Is it a real world practice level, or is it a policy level? We think about what is the level of the problem. So is this an individual or family level issue? Is this organizational or agency? Is this a community level problem, or is this really a policy systems level problem that impacts across agencies and across systems that would help us to, again, maximize our change? We think about what type of change is needed. So the answers that we generate really should produce actionable solutions that might lead to increased coordination, collaboration, increased access to services, might help us fill some of those gaps of unmet needs. And then we think about where leadership is needed to implement solutions. So some examples might be at the programmatic level, at a legislative level, at the budgetary level. And while we're not the people that are actually implementing those solutions, we're producing the information that will inform those levels. And so understanding what type of leadership is needed helps us to understand who to direct information to. Next slide, Lindsay. So I have 5 lessons learned that I've boiled down that I want to share with you. And the first is really the most important to me, is that voices matter. And I would have to say that this has been the most rewarding aspect of producing reports to me, is the opportunity to meet and interact with a lot of autistic adults who have informed our reports. So this is Lydia Wayman that you see pictured here, and she has produced blog reports for us and was involved in our initial National Autism Indicators report. And it's really important to us right from the very beginning and then all the way throughout the process of report production that we are involving people meaningfully, that we're really listening to them, that we are helping people understand how to be involved on our advisory panel. So understanding what the purpose of our research is, understanding what types of questions we are able to answer and are not able to answer, and then really helping people understand what is their role in the process, how can they get involved. And people have really taken this on wholeheartedly. Some people are mostly interested in reading and advising the content of our reports. Other people will get right in there and, like Lydia, help us to really edit and shape and make sure that we're using language that is respectful to a variety of voices and really conveys real life issues that people are facing on a daily basis. Next slide, Lindsay. So timing is everything. And it's important for us to identify when is the right time to introduce information that we're producing. John Kingdon is a political scientist, and his work in the 1980s helped us to understand that there are 3 aspects of timing that we have to think about when we are putting our information out into the world. So there are problem streams, knowing what the issues are that need to be addressed. There are policy streams of knowing what types of policy would impact that problem. And then there's a politics stream too that has to do with timing. And I think for me, a recent example that helps illustrate this would be COVID-19, if we think about the year 2020, the problem was COVID, and disparities related to COVID were very pronounced. The policy stream was a stimulus bill that was introduced to try to plug some of those holes for families and help them have some extra disposable income to meet their needs. And then the politics stream was that we were also in the midst of an election cycle. So if you put those three components together, that led to a window of opportunity to introduce the stimulus bill and ultimately to pass it. So we try to think about and keep in contact with people about what problems are really coming to the surface, and then how and when can we really plug information in to effectively translate that information to the people that need it to make decisions. Next slide. So design matters, and I would say that as a researcher who is not trained in graphic design and visualization of data, this has been just a great learning opportunity to see how when we present information in a way that people can really understand, how it can really change things. And I think that that's probably been one of the most successful and impactful aspects of our report production, is trying to find ways to help people understand on a meaningful level. And then we test these designs too, and test these graphs and make sure that people are really understanding what we think a graph is saying, or what we think that an infographic is saying to the world. It's really an opportunity also for a team approach, because not many of us are trained in research plus health communication plus dissemination techniques and graphic design. It really takes a lot of different types of people to be able to pull off effective dissemination. Next slide. So messaging matters, and messaging is worth time up front to think about even before we are engaging in research. What are the types of stories that we want to tell? What would be impactful in helping the people who are making decisions understand our findings so that it best informs their work. And so this is something, again, that we engage in throughout the process of research. We think about who the audience is going to be for the report, what types of information they need, and how to present the messages in a way that people will come away with the correct interpretation. So we're really kind of heading off misinterpretation by even right in the graph that you see here on the screen, interpreting for people, what does this mean? What does it say? And then we're inviting people to the table right from the beginning too, to weigh in on what are the most important types of information that they need in their work. Next slide. And then last but not least is that relationships matter, and relationships, no matter who it is on our advisory board, whether it's other researchers, whether it's people from the field who are using this information, whether it is autistic adults or family members, we cultivate their input early and often throughout the process. So dissemination, in our view, is not something that happens solely at the end of a research project. It's not just the final stage. It's something that we plan for from the beginning and continue to evolve throughout a dynamic process of report production. So it really is an ongoing cycle. Next slide. Lindsay, I think it's you.
Yeah, thank you, Anne. Anne and Paul both covered, excuse me, ways that we seek actively to engage individuals on the autism spectrum, as well as other community advisors. And we've included a section of this presentation that's focused on challenges, because despite our proactive efforts and real value of these processes, there's still work to do. So continuing to expand and diversify the individuals who are engaged across projects, and including also community advisors and how we can lift up practice. And in particular, that will be a component of our work focused here in physical health on the ARP project. Autism is not alone in thinking about these processes. Excuse me. And in fact, these are slides from a recent webinar from the National Cancer Institute, which displays on the left, the orange and blue bullseye, is the idea that policy and policymakers come online as we think about research and project activities toward the end. That we think about what do our findings mean for policy. And when we think about how policy dissemination and implementation can occur more meaningfully from the get-go, we can actually see that policymakers and thinking about our information process with those policy stakeholders is all along the way, from the very start of thinking about research questions all the way through how we translate findings. And that outreach and engagement really requires thoughtfulness, planning, and in alignment with many of the strategies that Anne and Paul hit upon, we need to continue to think about how to evolve this practice, in particular because we are at a critical juncture for the physical health of people on the autism spectrum, and that this project through ARP is well poised to help us get there. And one exciting component of the ARP project is that HRSA has been an innovative funder of dissemination efforts and allows for that intention around dissemination implementation, as well as for us to continue to build what our non-science communication looks like with policymakers, with other stakeholders who duly inform the policy process. We also need to continue to think about what those connections and reciprocal relationships look like. Anne talked about engaging autistic individuals as well as family members, and those relationships are key to shaping research questions and then communicating findings. Another avenue that we plan to pursue with a focus on physical health is the design of using data to help people interact with data. What does this data mean? Above and beyond what we put in peer review publications and our science products, how can we help the outcomes that we've identified translate across audiences and continue to be informative? Connections with policymakers requires many of the same components that we need to think about with any audience that we're seeking to engage. Intention, proactivity, the embedded research approach to working with policymakers all along the way and using their priorities as information ourselves to think about research triaging of what we might tackle, and then in turn, how we turn those findings back out to communities. That's challenging when there is a natural process by which policymakers are not always the same. They're not always in the same roles, and there can be turnover, but those relationships are informative all along the way, no matter how the policymaking process is evolving. We're also not the first people to the table to think about how we can help change the face of how our communities look. So as we think about physical health needs, as we think about ways that we can be using our research work to inform policy, there are many other policy victories that have substantively changed how our communities are formed and function, and maybe ways that we can think about how we take literal physical accommodations and think about them across the spectrum of autism, using that critical input from autistic individuals, family members, caregivers, providers, and policymakers, all sitting at the same tables, virtual or otherwise, to think about how to drive us forward. And we very much look forward to that work.
Wow, thank you, all three of you, very, very much, and also for your work in this area. So we now have time for some Q&A. I can read off. I know there was at least one question that was already submitted, but also for others, feel free to type additional questions in the chat box, and then we can read the questions out loud for the presenters. I'll also post a link for the feedback survey in the chat now as well. So I know one of the questions that came in A lot of agencies, governmental or otherwise, want to just approve last year's budget and move on to the next thing. When you see a gap in service, how do you generate inertia for changes in budget allocation or research focus to change? I'll let you all, decide. Paul and
Who
Nudie,
wants to
who
take
wants to
that?
tackle it?
You want me to take that? I can take a stab, and if you all want to add in.
Yep, I'll follow you, Paul.
All right, so let me just see. A lot of agencies, governmental, otherwise, want to just approve last year's budget and move on to the next thing. When you see a gap in service, how do you generate inertia for changes in budget allocation or research focus to change? Well, I'll just say we don't. Like, we don't generate inertia. That's not, we don't conceptualize our role as being the inertia generators. We try to be the informers of people who want to make inertia. So that's why we had such an emphasis on partnerships. So we're not policy influencers, we're not advocates, we're not lobbyists. We have to be very careful, especially with our federal funding sources, to make sure that we're not attempting to, lobby or change policy on our own. But we partner with advocacy organizations. There's a bunch of different autism-related advocacy organizations that we reach out to on a regular basis and partner with on various projects. Like I mentioned before, there are, at the federal level and in some states, there are legislators, legislative staffers, agency directors. There are people who care about autism policy and who are attempting to make change. And the insight from the Kingdon model is that it's very rare for any, even if we were a lobbyist, like even for professional lobbyists, it's almost impossible for any individual organization to have a lot of influence on the policy process, which is why you have to look for these windows of opportunity, and position yourselves as go-to sources of credible information, so that when a window of opportunities does open, say at the national policy level, then what happens is oftentimes, let's say during the CARES Act, the crafting and the negotiation, the arguing around what provisions would be in the CARES Act, there was kind of a faction of organizations that wanted to see an increase in funding for research related to transition to adulthood and adult services, right? So when that conversation came up during the legislative process, there was staffers did a quick scramble. They did their Google searches, like who's doing something about that, and our work popped up, and we got a lot of calls from legislative staffers on the Hill looking for data. Like, if we're going to make this a priority, we need to have some numbers, and we need it now or yesterday. And so that's our job. That's how we conceptualize our job, is to be positioned to be responsive when policymakers and advocacy organizations are at that crucible moment where they have an opportunity to influence the policy process. We can help by having information ready, so that, again, like, our mission is to aspire to support a process whereby policymaking is as informed as possible by credible, useful information at a population level. I'll hand it over.
We have a few more questions coming in. One person is asking, how are you engaging nonprofits?
I'm going to let Lindsay speak to this too, because she, sorry, Lindsay, has so many phenomenal collaborations at the local level in Philadelphia. But I think it's also the answer to that also relates to what Paul was just sharing as well, is that none of these are one-time shots. This doesn't happen as a linear process that we have some great answers and all of a sudden we swoop in and save the day and someone is right there who wants our information. This is about being in constant contact and having relationships with nonprofits, with policymakers, with agency leaders, with leaders of advocacy organizations who need this information, and having ongoing dialogue about what kinds of questions they're trying to answer, what's coming up in their daily work, what do they see with families that they're serving every day, and then helping them understand the types of answers that we can generate to inform their work. So again, it's a cyclical process. And Lindsay, I don't know if you can think of any examples from the Philadelphia area.
Yeah, I think, in particular, this year with COVID has been particularly challenging to nonprofit relationships, especially because of competing priorities and the impact that we've seen on how nonprofits are struggling. And I think that continuing to be sure to prioritize those relationships is two-way streets, and thinking about them for the long term. Relationships are generally not as successful when you're only turning to people when you need something specific. And I think that the other win for thinking about how you engage nonprofits is to say, what's going on? What do you need help with right now? What ways do you need data, information, support that could help you to meet the needs of the people that you are working really hard to serve every day? And I think those conversations can start small or big. And there's lots of ways, but keeping at it, making sure that you value them all along the path is really important.
I'd like to add one more thing there. So we were talking about our model for the kinds of questions we tend to focus on, which tend to be at the person level. What kinds of help do people need? What kinds of help do people get? How is life turning out? But I think that the COVID, I wrote a blog about the collateral damage of COVID and the impact the pandemic has had on the public and nonprofit sector. And the impact has been huge. A lot of nonprofits in many communities have just folded. They've been very stressed. State and local budgets are incredibly strained. Services are being cut for vulnerable populations left and right. And so we've begun actually thinking about how might we take the data question model and substitute the word or service organizations or nonprofit groups in there. What kinds of help do they need? What kinds of help are they getting? How is life turning out for the nonprofit and municipal services sector in the aftermath of COVID? Because I think there are some, as we quote rebuild, there's an important data story that needs to be told there about the needs of that whole sector, so that we can rebuild better and rebuild stronger. So Lindsay and I have been kind of scheming up some different ideas. And if anybody on this call is interested in that general theme, I would implore you to reach out, because we would love to partner with folks, maybe on a national survey or some kind of nonprofit sector study, where we're really documenting the impact of the pandemic through this collateral damage on budgets, staffing, involvement in the community, and so forth. Because it's not just affecting individuals. The pandemic has really torn at the infrastructure fabric of community services and left a lot of big holes. And as we reweave that fabric, we've got to be thinking about this whole service sector and the nonprofit sector, and how do we support not just individuals, but how do we support the rebuilding of these systems of care?
It's definitely very important work that needs to get done. I agree. Two more questions. One attendee asked if you all partner with the Autistic Self-Advocacy Network. And then a question after that from a student, if we have a few minutes left.
Yep. So, among the many partners that Paul and Ann were referencing during their components include the Autistic Self-Advocacy Network. One of our state level initiatives that was led through the ASSERT collaborative I mentioned earlier produced a self-advocate's guide to Medicaid in partnership with ASAN. And that partnership really helped to drive that product toward maximal impact on the people who need or would want that sort of information in a way that it would not have been successful without that collaboration. So I think, that's been a really gratifying experience, a heavily accessed resource, and looking forward to partnerships of all kinds, in particular as we pursue the physical health domain and continue to grow research and information in this area.
Same thing as well on the National Autism Indicators reports. We've had several members of ASAN serve as advisory board members, and we benefit so greatly from their wealth of knowledge and their lived experiences.
And I know that Lindsay has been active quite a bit already in our own Autistic Researchers Review Board and getting feedback from them and collaborating with them for upcoming projects. So that's been really exciting as well. A question from a student that came in. They said they're a student who's about to start a PhD with a research stream on supporting families of children with autism in rural communities in Missouri. So they're asking if any of you have any advice on how to involve policymakers from the beginning. And it's a research stream on supporting families of children with autism in rural communities.
Anne, you're on mute.
Thank you. So I happen to live in Missouri and led a family organization and have been active historically in some of the public policy around autism in Missouri. And I think Missouri benefits from some strong leadership in Central Missouri from the University of Missouri and the Thompson Center. And so I think that you would find that there are a lot of people that are already engaged with interacting with families and soliciting family voices. And if you would like to message me after the presentation, I'd be happy to connect you with some people. So.
And I do think that one of the lessons we've learned, certainly in Pennsylvania, which has, also some rural areas, is that the whole process we've talked about throughout this presentation, the engaging and the informing piece means, bring them into your world. Can you get, legislators to support groups or our self-advocacy groups? Is there a way to start to get to know staff members or understand where the policymaker priorities are currently and where they might be headed in the future?
Awesome. Thank you very much to all three of you for being here and for the information. I dropped a link to a brief survey for people to complete in the chat. And then also I wanted to mention our upcoming webinar for April. As many of you are probably aware, April being Autism Acceptance Month. And so our April webinar is going to be hosted by our Autistic Researchers Review Board. And I will drop a link into the chat right now. And then also it's on the pages that Lindsay's screen sharing. But we're very excited to hear from them next month. Don't hesitate to reach out if anybody has any additional questions. And thank you again for attending the AIRP webinar. Bye, everyone. You're muted, Paul, but don't worry, we get the sentiment.
Thank you, everybody.
Yeah, thank you, Lindsay, Paul, and Annie. Really appreciate you all being here.
Thank you. That was fun.
Thanks, everyone.
Yeah. Have a good day, everybody. Take care. We hope to see you next time.